Hello, everyone. Hello, I'm Susan Cole,
And I'm Matthew Hodson.
and welcome to aidsmapCHAT, our show for, bringing you news about HIV for people all around the world.
That's right. And this week we've got a fabulous lineup of guests. We have Dr. Peter Ghys of UNAIDS, who is in charge of ensuring a better understanding of the state of the AIDS epidemic at both national and global levels. We also have an incredible HIV activist and poet, Bakita Kasadha, and a long-term AIDS survivor and the senior editor of ANU magazine, Hank Trout. I'm stuttering over everyone's names. I do apologize.
So, Matthew, how are you? How's your week been?
My week's been fine. It's the usual thing, not going out very much. Actually, that's not true. I went out last night, so
Ooh.
I'm really putting myself down. Um, but I guess it's one of those things, isn't it? You're looking around and at the world, our new world now, and memories become very important. And Facebook, which I think is a despicable platform, quite frankly. But I do really enjoy the Facebook memories that come up. And I had one the other day, which I thought was quite interesting because it was from 2017. So that's just 3 years ago. And I was speaking at a conference in Barcelona and I talked about U equals U. And it was a conference for healthcare providers. And at the end of my piece, someone came, it was actually a question they asked, and they said, well, you can't tell people living with HIV about U equals U because they might stop using condoms.
Oh,
And I'm like,
that's a
what? Like, well, I mean, it's not that I want people to stop using condoms, but, it's really important people get this information and you can't conceal information from people to manipulate them. That's really the wrong attitude from healthcare providers. And there's a story on aidsmap, that excellent source of information. We've just published it this week, and it's about a new survey which was done of people living with HIV. And it found that a third of people living with HIV had never had that conversation with their healthcare providers. Their healthcare providers had never told them about U equals U. And actually, 12% of people living with HIV globally still did not know this message, did not know this. And this news, it's so important. It's so liberating. It has such a power to relieve, to make ourselves feel better about our bodies and about the sex we have. So I just think it's just a disgrace that anyone should conceal that information. I really hope that memory from 3 years ago doesn't reflect where we're at now.
Hmm. Yeah,
Yeah.
yeah.
How about you? How's your week been?
But quite a lot of not going out. But actually, this week I did go out. I went out for dinner. I did sit outside, but I met up with Sylvia Petretti, who is the chief exec of the brilliant charity Positively UK. And
Lovely, Sylvia.
she's wonderful, and we had a brilliant time. And what was fantastic, someone actually told us like how beautiful we were looking while we sat there, which was brilliant. So,
It doesn't surprise me at all. You're two of the most beautiful women in my life.
oh bless you. So yeah, that was really wonderful. So it's been a good week. There's been lots of great stuff happening this week for women living with HIV. The women's charity, the Sophia Forum, have released a fantastic campaign this week about the needs of older women living with HIV. And yes, back to the M word, relating to the menopause. I know I'm always banging on about dry vaginas and painful sex, but so
I'm,
yeah,
I'm, I just love to hear you talk about vaginal dryness,
yeah,
Susan.
it's yeah.
Every day that you tell me about it, I feel like my life has been uplifted. So tell me, what does the data tell us about HIV and the menopause for women?
Well, the data does tell us that women living with HIV may experience the menopause a little bit earlier and may experience worse symptoms. But women living with HIV do not need to suffer in silence. There is lots that they can do. So it's looking good. So everyone check out what the Sophia Forum is doing at the moment.
Very sound advice. I know you will never be silent about the menopause, Susan. I rely on you for that.
Wonderful. I will tell you every day about vaginal issues. So you're very lucky.
That's great. Thank you. Can we get a guest on, please?
I'm like trying to think of a segue in terms of, if only we had an international organization that knows quite a lot about women living with HIV.
Right.
And you also know about men, but we don't want to get into that kind of argument. Anyway, so Dr. Peter Ghys, now you work for UNAIDS, and you do some of the monitoring kind of on where different countries are in the struggle to combat HIV. Now, obviously, this year it's 2020, and UNAIDS set the targets that we will get by 2020. We're going to have 90% of people living with HIV diagnosed, 90% of people who are diagnosed in treatment, and 90% of those virally suppressed to an undetectable level. How are we doing?
Well, thanks a lot for having me on the show. And as you mentioned, my unit actually does track both epidemiology and programs across the world for different countries. So to be responding to your question, then, how is the world doing? And we have to say that the provision of treatment to people living with HIV has been quite a success, and it has seen dramatic decreases in mortality among those people. As we look at the year 2020, as you mentioned, it is the year for which the target exists, the 90-90-90 target. It looks like overall the world is not going to reach that target. But as we look at specific countries, we do see that a few countries actually did reach it. If you take the 90-90-90 goal as as relevant for the country as a whole. Mm-hmm. And so within that, we see that about 14 countries have actually reached it, and about 2 countries actually have made it to 95-95-95 already. And that's for 2019.
That's fantastic, isn't it? So what do you think are the major actions that governments need to take now? Because if we're not going to hit the target, how do we start to make up for it? Because it's actually about elimination by 2030, isn't it?
That is true, but it is also true that not having made a target, it comes at a cost, and the cost is always expressed in numbers of people that got infected where they would not have been infected had we made a target, and also people that die because we didn't quite bring treatment to enough people. So as it comes to what should happen next, what we think is that since we are in the year 2020, that it will be useful for the world and for countries and communities to actually have a new target that we are placing that in the year 2025, midway between today, 2020, and the year 2030 that you mentioned, because we think it's a useful period, politically, and for people to have, to relate to. So that is one thing that we think need to happen. Then one other thing that I would like to mention is to say that, as I mentioned, some of the targets have been reached or not reached at a national level. So that just hides a lot of disparity within such country, where you would find that maybe older people maybe have higher rates of coverage than younger people, and also some of the key population groups would have typically lower coverage than other groups of the population in that country. So we think that in the next phase, it will be important to actually track the performance in specific groups, whether it's defined by geography or by sexual behavior, etc., or age, those different dimensions we think will need to be better tracked as we get closer to achievement full coverage.
You mentioned the impact of COVID. What lessons from HIV can we apply to the COVID response?
So we think there is quite a few, and the COVID response has seen a lot of leaders that actually have shifted almost seamlessly from working in HIV to working in COVID. We've seen it as we watch TV of the US, where some of those leaders, Tony Fauci and Debbie Birx, they're actually HIV people, if I can say. They're very prominent in the HIV field, but also at at a community level and the actual programs. There has also been use of laboratory infrastructure that existed for HIV and for viral loads has actually been easily shifted to testing for COVID. There has been very important work of like community groups that are active in HIV that have also like shifted. Like in the first instance, they've done like better in providing services to people that are needed living with HIV, but have also brought that experience to the COVID response. Yeah. And so, I'm sorry, go ahead with your question.
Well, because I think one of the things which Winnie Benima was talking about is that kind of person-centered approach, which I think we've really learned from HIV. That it's nothing about us without us. I know we're going to be talking about that later as well, but I think it's really exciting in some respects to see how the world is changing and how that paternalistic attitude, perhaps sometimes of healthcare providers, we're recognizing how challenging or even damaging that can be, because actually we need to be involving people in their own healthcare and listening to them as well. And I think that's a real lesson from HIV that we can apply to COVID.
Yeah, I would fully agree with that. And also too, if I can quickly say, like, as it comes to like disruption of HIV related services, that there was a lot of concern when the COVID epidemic started to hit, say, communities and countries where there is a lot of HIV and a lot of people on treatment, that actually the disruptions of the treatment in terms of supply have not like played out as was feared at some point. And of course, some of that is due to the fact that people have taken action to try and prevent those disruptions. But then also that policies like multi-month dispensing have actually seen like an acceleration because it was like needed or appropriate in COVID times where people could not go to clinics as frequently, etc. So I think that some of the COVID epidemic has been, say, a little bit beneficial to the AIDS response, even though, as one looks at numbers of new initiations and also the numbers of people that like test for HIV, that has actually decreased. So that is a little bit of a setback, I must say.
Peter, thank you so much for coming on the show. It's been really great to talk with you.
Thank you so much.
Thank you for having me.
Hopefully see you again. Bye-bye. Oh,
right.
That was wonderful.
Yeah.
One story that's really struck me on aidsmap this week is a study that showed that adult doses of dolutegravir is safe to use on children that weigh more than 20 kilograms. I think kids usually reach that weight between 6 and 12 years old. And what's really exciting is, based on these findings, the WHO have updated their pediatric guidelines. Now, I think this study is really important because it simplifies prescribing for young people and reduces the likelihood of stockouts nationally and at smaller clinics where fewer children are treated. And kids now will be able to take one pill once a day. But although this is a huge leap forward, so much more is still needed to ensure children with HIV can access improved regimens. Young children in particular have the most limited access to treatment. AIDS-related illnesses continue to be one of the leading causes of infant mortality. In 2018, 100,000 children died from AIDS-related illnesses. This is devastating and outrageous, and we need to do so much more to save the lives of children living with HIV.
Absolutely, really well said. Thank you. It feels You're the segue queen, and now you've given me the role of segueing, and it's really difficult to move on from that because obviously every life is so precious. But I've got to introduce our next guest. Our next guest is someone who I first met. I think it must have been like 4 or 5 years ago. I was at a meeting and I sat at a table, and they said, "Oh, and our next speaker is Bakita Kasadha," and this woman, this young, very young woman, very young, beautiful woman, sitting opposite me, stood up, moved over, and delivered this extraordinary poem from the stage. And it was so passionate and so powerful and so moving. And by the time she came back to my table, I was completely obsessed with her. And now I'm really delighted because she's now writing for aidsmap. So, tell you what, if you impress me with your poetry, I'll give you a job. Bakita, fantastic to see you.
Thank you so much for having me, number one groupie.
Bakita, the Children's HIV Association camp this year was virtual. I was there last year and it was wonderful. But I hear that the virtual camp was still brilliant. And you did some fantastic sessions for the camp with some great interviews. So Bakita, what are some of the issues that young people living with HIV have shared with you, particularly around the pandemic? How has it been affecting them?
Thank you. It's a really good question. I think it really depends on where we are in the world, placing that question in the world. So you mentioned Chiva first of all. So a lot of the young people who visit Chiva, it's an opportunity for them to meet people who are living with HIV and their own peers. So it created that disconnect where they weren't able to come together as they would normally for camp. When we're thinking about other parts of the world, for some people it meant it being a bit more difficult to take medication. Now, I know Peter mentioned that there wasn't as much of an impact in terms of access to meds, but in certain countries where there were strict laws in terms of lockdown, going to clinic became a lot more difficult. Being asked why you were going to clinic meant that some young people were having to share their HIV status or worry about sharing their HIV status. But there was also a lot of community galvanization where young people actually delivered medication to those who weren't able to get medication because of the pandemic. And that's been documented by Y+ Global.
Yeah, that's absolutely incredible, and young people have been really leading the response, and it's just, I think it's so wonderful. But there's been a real impact on everyone's mental health and emotional well-being. What strategies would you say to young people living with HIV who might be finding it difficult to cope at the minute? What could you recommend?
Yeah, it's such an important question, and it's tricky. Where possible, I will always recommend reaching out to people, whether it's other people living with HIV, whether it's a support system. I think this is a time where we've really needed to be kind to ourselves. So in regards to even how productive we are, and if it's not how productive we normally are, and just being a little bit kinder and a little bit nicer to ourselves, trying where possible and if it's accessible to really focus on adherence and taking your medication at all times, especially now, as a part of self-care. And just when you need support, if you want someone to talk to, try to reach out, whether that's digitally or socially distanced, face-to-face, depending on the laws of your country, that is.
Yeah, interesting. You brought up laws because obviously we've been part of a movement looking at the criminalization of HIV transmission, and now we're seeing laws springing up or being used for COVID transmission. How effective do you think such laws are?
I don't think they're effective. I will also expand, but the headline is I don't
Yeah.
think they're effective. So
Headline, I agree.
laws that I think often when it comes to approaches to do with public health, human rights and public health are seen as sitting on different ends of a spectrum, which I don't think is appropriate. One can't be foregone for the other. And often those criminalisation laws can exacerbate public health problems, often affecting groups, as we know, are more affected by HIV. And it has a massive effect in terms of impact on testing, and just access to healthcare. So for me, it's a concern. And like you say, we have been seeing in certain countries across the world that being used as a means to control this pandemic, but I think also used under the guise to control this pandemic and being used for other means.
Yeah, it's a real concern, and I did raise it because Bakita's written very brilliantly about this, and I will be posting that article up again after the show because it's fabulous. Bakita, it's always good to see you. Wonderful to see you. Thank you so much for coming on the show.
Thank you so much, Bakita. See you soon.
Thank you.
Bye.
Oh.
Oh, dear. There's another news story. I just want to mention it because it is quite exciting. There has been a study, which again we published on aidsmap this week, about PrEP use for trans people. And what's particularly exciting and good about this story is it refers to a piece of research which is actually looking at about PrEP's efficacy for trans men. And trans men in particular are very often ignored or left behind in research like this. The headline news is that on daily dosing, there's no clinical significant difference between trans women, trans men, or cis women or cis men in terms of reaching that level which is required for PrEP to be effective. So it's really good news. It's a small study. It is looking at blood rather than body tissues, so it's limited, but it's starting to get data out there, and obviously it's really important that people, whatever their gender, whether they are cis or trans or non-binary, can have confidence in that the drugs have been tried with them and it will work for them. So it's really exciting news.
Yeah, that is really exciting. And let me try and think of the segue from that to bring in our guest. So I guess, yes, we have somebody who has indeed been living with HIV for so many more years when we didn't have these types of technologies. Welcome, Hank.
Welcome.
I'm here.
Hank, so I really wanted to have you on the show today because you have co-authored what is now going to be referred to as the San Francisco Principles. Now, the San Francisco Principles acknowledge that the majority of people living with HIV in the US, and it's also the same in the UK, are now over 50. And many of whom are what we would classify as long-term survivors, i.e. people who were actually diagnosed, as you were, before the advent of effective HIV treatment. I mean, I was diagnosed 18 months after the advent of effective HIV treatment, and I know that was a very different experience for me as a result of that. Yes, I believe you were diagnosed in 1989, is that right?
Yes, in July of 1989. And the odd part was, when those of us who were diagnosed before the cocktails became available, the doctors handed us the diagnosis with one hand and a death certificate with the other, just waiting for the appropriate date to be filled in. We were told to get our lives in order, to get ready to disappear. And a lot of us have been told that more than once. I've been told that more times than I can count, but we're still here.
Yeah, and I think that's what I guess that's what I would say the San Francisco Principles are about. I mean, I'm not the writer; you're the writer, but that sense of being told to disappear. Yeah. Do you feel that now as a long-term survivor?
Oh, absolutely. It seemed those of us who have lived for this long were certainly grateful when the cocktails came along, but once they were available, the medical community pretty much abandoned us. I mean, their attitude seemed to be, well, we saved your lives. Now go sit in the corner and take your medicine like a good little guinea pig. Nobody envisioned that we would be aging with HIV. I mean, I was told I wouldn't live to see 40. And so, it's a fairly new phenomenon. But still, we're being ignored. I mean, we are routinely ignored at national and international AIDS conferences. For instance, at AIDS 2020, out of hundreds of hours of presentations, there were only 2 one-hour sessions about those of us who have lived with this diagnosis for 30, 35 or more years. We are routinely ignored.
So,
Hank, what would you say needs to be done to ensure long-term survivors are adequately supported?
Several things. One of the major things is medical providers need to be trained in treating people with HIV. There's a real dearth of education for medical providers about the things we go through and the needs that we have. For instance, it turns out that those of us who have carried this virus this long age faster than people who are HIV negative. I mean, various comorbidities show up in us 12 to 15 years early compared to negative people. It's sort of like, the new 65 is the new 80. We're subject to many comorbidities that occur all at the same time, like liver disease and heart disease, osteoporosis, balance issues, kidney failure, unstable housing, poverty. I mean, isolation and loneliness. When I finally discovered that there was a group here in San Francisco for us long-term survivors, it was the first time I realized that there are enough of us to make a group. For the longest time, I honestly thought I was the only one who would survive, because in a period of 10 years, I buried my entire circle of friends. And most of the long-term survivors I know have gone through that trauma. And we still live with a form of PTSD known as AIDS survival syndrome. And so we have many physical and mental health needs that simply are not met.
And that trauma, I mean, it must be. Well, I mean, I think even though I was diagnosed later, I still feel a part of that generation. I lost so many people, and to be living through another viral pandemic, it's
been incredibly difficult. When I first heard the word pandemic in the news, it took me aback. And I was like, oh God, here we go again. And there have been several things that were very triggering. Watching the death toll rise exponentially every day reminded me of those early days of AIDS when our friends were all disappearing. And the other thing that it reminded me of is that our government is utterly incompetent. They really screwed up with the AIDS pandemic. Ronald Reagan didn't even say the word AIDS until into his second term. And here, we have, I know how we all feel about Mr. Trump.
We have a family audience.
Yes, we are being led by a blithering idiot who doesn't seem to care about much of anything. And so that's been pretty triggering.
Hank, unfortunately, we're running out of time. I could talk to you forever. I'm so glad you've written these principles. There was a passage I was going to read out, but I don't think we have time for it. But I will be posting it online. There's talking about that collective experience of long-term survivors, it's so important that we continue to talk about it. It's so important that the same principles of nothing about us without us are carried out for long-term survivors. Thank you so much, because
we've already posted the principles on Facebook, and we have our own page. It's just called the San Francisco Principles 2020. And if you'd like to support us, you're more than encouraged to sign on.
I'm very happy that the NAM aidsmap has done so. Thank you, Hank. Thank you so much.
Thank you. Thanks, Hank.
Thank you.
Oh, I can't believe we have run out of time.
It goes by so fast. What is it you do? It's that witchy magic.
And I haven't muted you.
Yet.
Yet this time. Well, we will be back in a couple of weeks, not with aidsmapCHAT, but with aidsmap Live, focusing on living a long life with HIV.
Yeah, and I think I'm going to be a guest, aren't I? So that'll be nice. You can just ask me questions, and I can just sit there without having had to prepare in advance. It'll be great. I think I much prefer that.
Oh, thank you so much. I want to say a huge thank you to all of our guests and to Disruptive Live for their technical wizardry and keeping all of this going.
Thank you. Yes, thank you very much, Hank. Thank you very much, Peter. Thank you very much, Bakita. Thank you very much for tuning in, and we'll see you in a couple of weeks.
Thank you.
Bye.
Bye.